Abstract 388 is an abstract looking at the effect of or the outcomes related to dose modifications in patients who were treated on the NAPOLI study. And I think this is really important because we recognize that patients with pancreatic cancer often can't tolerate 100% dose, and then we're not actually sure that we're going to achieve the outcomes that are seen in the clinical trials. So this was looking specifically at those patients who had either a dose delay or a reduction in the planned dose that was administered in the first 6 weeks of the study, and the delays were defined as a delay in dosing about 3 days from the target dose. I think what was quite encouraging from this is to recognize that the survival outcomes are very similar, even if patients who had dose delays or dose reductions on treatment. I think what would be interesting is to know what the relative dose intensity was. So we recognize that often patients need to have a delay in treatment, but over time the dose intensity in terms of how much chemotherapy they actually receive over time is fairly similar. There's already been work on this in other disease sites, breast cancer and lymphoma particularly, looking at relative dose intensity and recognizing that if patients are able to receive between 80 and 85% of ideal dose, that your clinical outcomes are probably preserved. We recognize that pancreatic cancer is not that chemosensitive a disease, so the same may not apply. Although it is very reassuring because this is exactly what we do in clinical practice in terms of delaying treatment or doing a dose reduction, it's reassuring to us to know that those types of alterations or modifications to the schedule won't affect clinical outcome based on the results of the subgroup analysis. I think it would also be important to know what the relative dose intensity was for these patients. So I think when we look down in terms of the details of the study, when I think about patients who require dose reduction on treatment versus not, I think especially in advanced pancreas cancer, that's being driven a lot by performance status. And so when we look at the performance status in terms of the baseline characteristics of patients who had a dose modification versus those who did not require dose modification, we do see that difference. If you look at specifically patients who were Karnofsky performance status 90 to 100, so those are your really good performance status patients, about 66% of patients did not require dose reduction versus it was about 48% who did require dose reduction. So that's telling us again that that it's the poorer performance status patients who likely require that dose modification. The fact that the outcomes were still similar is even more impressive because we recognize that performance status drives a lot in terms of outcomes in patients with pancreatic cancer. I'll just comment on one other thing that I noticed in the abstract. There was also a disproportionate percentage of Asian patients who required a dose reduction. So it's about 44% of patients who, in the patients who required a dose reduction were Asian, compared to just over 10% in patients who did not require dose reduction. So apart from the differences in terms of performance status, there might be some pharmacogenomic issues in terms of drug metabolism and so on that might be relevant here. And then if that's the reason for dose modification, although the administered dose might be less, potentially the effective dose that patients were receiving might have been fairly similar, so that might explain those outcomes. The bottom line is, though, it's reassuring for clinical practice.